Hello, everyone. This is Dr. Greg Murphy. Today, between my congressional appointments, I saw a few patients. I also took the liberty of going over to our hospital where we have a large ICU and seeing some of what's going on with them and how they're dealing with COVID patients. I will tell you, our workers, our staff, our doctors, our nurses, our respiratory therapists have been tireless workers through this entire pandemic. I think our hats are off to them. This is now the fourth surge that they have been through. And they show up to work every day knowing that they came here for a purpose, and that's to save lives. We really, really need to support them and understand the terrible stress that they are going through. So let me just throw a few statistics at you, just really going through our ICUs. Of the individuals who are now in the ICUs with a breathing tube put down, 90% have not been vaccinated. There are 10% who have been vaccinated, and despite that, have gotten sick enough to need a feeding tube. But over the overwhelming majority of the individuals in the ICU. Now, again, some people have said it's one particular political party or one particular demographic. It spans the entire spectrum. So it's not just one particular thing. So please, let's not make the vaccinated, unvaccinated thing about politics. Let's make it about health. Let me talk to you also about some of the other statistics. When you get into an ICU these days, you have approximately a 60% chance of not coming out of the ICU. Those are the true hard facts. Breathing tube, if it ever gets that bad, means there's enough damage in your lungs that you may not, and have a high likelihood that you will not survive. So it's a talk about prevention of getting to the ICU. And what we're seeing now, it used to be our median age, half above, half below, or really the average age in the ICUs was in the high 60s, if not early 70s. In our ICU today, the average age was 48 years old. 48 years old. Again, the sicker people oftentimes have those comorbidities, the obesity, the diabetes mellitus, the kidney disease. However, it can occur in 25-year-olds who are stone cold healthy. So this is an argument. Yes, we're talking about vaccines here. We talk about, well, should I take one or should I not? This is a decision I think that each of you need to sit down with your doctor and talk about. Talk about the risks and the benefits. There have been this talk about myocarditis that has occurred in vaccines, inflammation around your heart. Well, a good journal in the New England Journal points out that your risk of myocarditis is 10 times higher if you've had COVID rather than if you've had a vaccine. And that's across all age groups. The other side effects that can occur, with this vaccine, it's just like any medicine. So I urge you, really, sit down with your doctor and talk about this. I don't agree with the government telling you what to do. I think all these things, like any medication, should be between a doctor and a patient. That's where trust is. And sometimes, and I've heard this 10,000 times, it's about, hey, I don't trust the government, and I don't trust this, and I don't trust this. I can sympathize with that, rather, just because we've been told so many different things by Fauci or so many different things by the CDC. But sit down with somebody that you trust, your doctor, and have this conversation. So 2 takeaway points here, please. Number one, and most importantly, I talked about our staff, the nurses, the dedicated doctors, respiratory therapists, everybody in the hospital who make things work. They've shown up to work every day. They've shown up because they took an oath to care for patients. They're at the bedside all the time. They're caring for the patients. Please say thank you. Thank you for the tireless work now in our 4th surge that they're undergoing. They are the true heroes today. I get sometimes irritated when we talk about heroes with a basketball or football. The true heroes are the ones over at that hospital who are taking care of patients all throughout the night, all throughout the day. Those are our true heroes. And one other poignant part, which hit me very, very hard today as I walked in and talked to several of the doctors and nurses there, it's called vaccine regret. Vaccine regret by patients who are undergoing just before they get a breathing tube put in that say, I wish I had been vaccinated.